this is an audio to discuss the PowerPoint slides that you have for this lesson regarding the medicine chapter of the textbook and the medicine section of the CPT manual. So the first thing that I want you to do, and that you always should be doing before you do any type of assignment of a code, is to go to the section itself in our CPT manual. So open up your CPT manual to the medicine section, which is page 476, is where we have medicine guidelines. And you know, our guidelines are always like in the lighter green paper, so you're going to see that. And you'll see that we definitely have some guidelines in here. So that means that you absolutely have to take the time to read the guidelines before you even attempt to try to assign a code. But then always my next best suggestion for when you're in any section of the manual, and when we do the advanced class next semester, which I am teaching, we will also have a lot of audios, etc. But again, what I really want you to get into the habit of doing is paging through the manual itself and just looking at what types of codes are in here. So when I turn the page after the guidelines, I'm finding immune globulin, serum, or recombinant products. And then we get into our vaccines and toxoids, which right now I guess you can't call a drugstore without hearing about, do you want the flu shot? So if you're going to find your flu shots, your pneumonia shots, all of your pediatric shots are in here. And of course, the most very important and basic thing to know about any vaccine is that you always have two codes, one for the vaccine and one for the administration. So we're paging forward. After our vaccines and toxoids, we get into a psychiatry section of the book, of our manual. And again, there's instructional notes, so that obviously means that you have to take the time to read the instructional notes. Then we get into diagnostic procedures for psychiatric diagnostic procedures, psychotherapy, biofeedback, and we also find in this section of the manual, another big topic for the medicine section, our dialysis codes. And you know, somebody who is on dialysis would be a patient who is in end-stage renal disease or chronic kidney disease. Most physicians document them in stages. There's 5 stages of kidney disease, and they would say chronic kidney disease, stage 1, stage 2. And in your ICD-10 class, I don't know if you're up to that chapter or not, but you would see that they are definitely coded by the stages. So then we move forward, and we have a little bit of gastroenterology codes. And then after that, we have our ophthalmology codes. And going forward from that, we have some vestibular function tests, audiologic function tests, and at the very end, we have our coronary therapeutic services and procedures, and our cardiography codes, cardiovascular monitoring services, and implantable and wearable cardiac device evaluations. So in the medicine section, I will tell you, moving forward, you're going to see cardiac codes. This is where we would code our echocardiograms, our EKGs, and our cardiac catheterizations, which we will talk about. Now, what I want you to notice also is all of these codes begin with the number 9. So if we're in the medicine section of our CPT manual, what I'm saying to you is that most of our answers would obviously be with the number 9 in the beginning. So the only other place where we really see the 9 in the beginning is our E&M codes, but that really is a 99. So let's look at our slides. Coming down on this slide, we're saying that we're going to have a variety of services and procedures. We have our immunization codes, the psychiatry codes, exactly the pages that we just paged through looking at our manual. When we code for an immunization or a shot in layman's terms, we always, and if you want to put a note to yourself in the book, that whatever is going to make you remember that when we are coding an injection, you have a code for the actual administration. And I'm actually saying and telling you that the administration codes are going to be found from 90460 to 90474. And then you will have an additional code from the code range that you see on the slide in front of you, 476 to 749, for the type of shot that we're given, whether it's measles, polio, pneumonia, the flu shot, etc., etc. So, moving down to this slide, 90460 is for immunization administration, and the key thing that I want you to focus here is that it's through 18 years of age via any route of administration, meaning is it in the arm, is it in the butt, etc. Now, this is in red because it's saying through 18 years. So I don't know if when you print out these slides, which if you haven't done it, if you haven't printed out all of the lecture notes and all of the slides that I've given from day one of this class, I urge you to do that. You're definitely going to want to be organized in a binder, and you may want to refer back to them next semester, but it's just a lot of information, and I definitely want you to keep it. But what I would do is in your actual coding manual at 90460, I would highlight that 18 years so that you definitely know when and when not to use that code. 90461 is if you're giving more than one shot. So if there's another vaccine or toxoid component, you would list 90461 as an additional code. And I believe we will have some examples of this in your book and maybe even in the lecture notes. So when we're talking again about our vaccine administration here, a vaccine toxoid component refers to each antigen in a vaccine that prevents disease. Again, keywords here, each antigen. So combination vaccines such as measles, mumps, and rubella, or our MMR, would have multiple vaccine components. So let's look at this example. Here we're saying that a 15-month-old child receives a vaccine for DTaP. And I'm telling you that we have diphtheria, tetanus, and acellular pertussis. What we're saying is that we're going to have more than one administration code. Why? Because we have 3 different toxoids or 3 different components of this vaccine. We have the diphtheria, which would be 90460, but we're saying that we need 90461 times 2. Why? Because we need 90461 for the tetanus portion of the shot and for the acellular pertussis. And then the actual vaccine is coded with 90700. So look again down at the bottom here. We have our DTaP shot. The vaccine code is just 1. But for the administration, and remember, you always have at least 2 codes when you're coding a vaccine. Again, 1 for the administration and 1 for the vaccine. So let's scroll down and look at our new slides. New in 2013 are our PTCA codes. So if you are a little fuzzy with what a PTCA is, it's a percutaneous transluminal coronary angioplasty. then you need to review that in your anatomy, or you can Google it. One of my favorite sites on the internet, and I may have given this to you, is medlineplus.gov. That's medlineplus.gov. Put that in your favorites. It's terrific. Also love WebMD. Very, very reliable, accurate sources. So when we talk about a PTCA, what are we doing? It's percutaneous, meaning it is less invasive. And typically when you think, or when I think of a PTCA, I think of somebody who maybe had a stress test and the stress test came back abnormal. So the doc says, okay, we're going to do a cardiac catheterization. When they do that catheterization, they find that you have a blockage, but maybe the blockage doesn't require you to have a bypass graft or a CABG. They can fix it doing a PTCA. So what they would do is send up the catheter, and then where that narrow part of the artery is, they put sometimes a balloon in there. They inflate the balloon so that the plaque and the narrowing opens up, and then when they let the balloon go down, hopefully those walls of that vessel, that artery, stay open. If they don't stay open, that would be a situation where possibly the patient would put a stent, or the physician obviously would put a stent in there, and that would keep the walls open. So that's just a little quick anatomy introduction for you. And here you can see our picture of exactly what I just explained, with the balloon going here. Then they inflate it, and then hopefully when they deflate it, the vessel remains open, or patent as we call it in the medical world. And here is our stents, just as I had explained. So let's talk about the coding of this. We include the catheterization vessel, traversing the lesion, the S supervision and interpretation, closure, and imaging. But we may have diagnostic coronary angiography that is reported separately. When we talk about diagnostic coronary angiography, what are we talking about? We're talking about pictures, basically. So if somebody is having a catheterization, there's always pictures that are taken inside of those coronary arteries, and that is what we call angiography. So let's go down here and look at our PCI coding hierarchy. Then let's also turn to this code in our actual CPT manual. So let's go to 92943, and let's look at this code. 92943. Now you're going to see this was all changed because it's green in our CPT manual, so that means these are all new codes. So 92943 is a percutaneous transluminal revascularization of a total occlusion, okay? And then 92941, if we look at that, that is a percutaneous transluminal revascularization of a total or subtotal occlusion. And then 92937, if we go and look at that code, it is percutaneous transluminal revascularization of or through a bypass graft. So that would be that somebody has already maybe had an open, CABG bypass procedure. Now, we have then our atherectomy. When we're talking about an atherectomy, we're removing plaque within that vessel, and we have code 92933 that I would like you to look at. Again, atherectomy versus a PTCA. They're two different things. With ectomy, remember, ectomy is the suffix that means removal or excision. Well, in this case, it would mean removal. We're removing plaque in that vessel. And then if they're doing it with the stent, 92933, if we look at 92928, it is percutaneous transcatheter placement of the actual stent itself. Now, again, if we look at 92924, it's without the stent. And then if they're just doing angioplasty, meaning they're sending that balloon up there and trying to open that area that has been stenosed open, that's where we're looking at 92920. So again, if you guys aren't familiar with what angioplasty is versus an atherectomy, then you really have to take the time to look it up. And I think that's where a lot of you run into trouble. You'll assign a code, and the codes that you'll use, to me, being obviously a coder, they don't even make sense. And so what I know that I have, when I've talked to students before, 9 times out of 10, it's because you think that you understand something, but you really don't. So all I'm really saying to you is please, please, please take the time to look it up if you don't know what you're talking about. Our major coronary arteries, we have our base codes for the column on the left, and then we also have the abbreviations for each, and then if there's any recognizable branches for them. Now there should be, I believe in the CPT manual, as you know, there's a section that has pictures, anatomical and procedural reviews, and we should be able to find a picture of the heart and the vessels of the heart. I don't want to take the time right now to look for it, but I definitely want you to find the pictures of the heart in this manual. I just don't want to be silent here while I'm discussing the rest of this PowerPoint. I will definitely address that and tell you where to find it. Coronary arteries. All PCI procedures performed in all segments of a single major coronary artery through the native coronary circulation are reported with one code. One treated through the native circulation and another segment treated through bypass graft, you report the bypass separately. So the PCI is reported for up to 2 branches of a major coronary artery. So what I'm going to suggest again to you is there are a lot of instructional notes before these codes. So what I would like you to do is to make sure that you take the time to read through them and also to highlight as you see fit, okay? Also in here, you will find our pacemaker codes, which is another really popular part of the medicine section are our pacemaker codes. Okay, let me just continue down here. So our cardiac catheterizations are diagnostic procedures. Again, in the medical world, maybe a patient has chest pain. They go in, they have a cardiogram, meaning an EKG. EKG comes back abnormal. Doc says, you know what, you have to have a stress test. You go in for the stress test. The stress test comes back abnormal. Next hierarchy, next step would be a cardiac cath. Cardiac cath is where they go through the femoral artery and they can have an exact picture. Remember, our pictures we call our angiography, an exact picture of what the coronary vessels look like. Are they open or patent, or are they occluded? If they are occluded, can it be handled by a PTCA by putting up that balloon into the occluded part of the vessel? Do we need a stent, or is this patient going to have a CABG or a coronary artery bypass graft? So here we are again, we're talking about our cardiac caths. This is this particular coding of cardiac caths changed within the past couple of years, and I have to tell you, it became much, much simpler to code a cardiac cath because, and the reason for that is because cardiac caths include all of those 3 points that you're looking at here on this slide. The introduction, positioning and repositioning, the recording of the pressures, and the final evaluation and report. Now remember, the cardiac cath itself is considered a diagnostic procedure. Let's review what the difference is between a diagnostic procedure and a surgical procedure. And by the way, you can use a lot of this exact same stuff that I'm telling you for your ICD classes. When we're talking about a diagnostic procedure, we're performing a procedure to find out the diagnosis on a patient. What's wrong? Think of it that way. When we're performing a surgical procedure, we're fixing something that we maybe had found out about in the diagnostic procedure. So now our next slide here is a picture of how they go into, the femoral artery down here. They send up the catheter and then they're going to get a clear picture of what's going on with that patient's heart. Now, here are cardiac catheterization codes. If you go to these codes that we're looking at on the slide in front of us, 93530, let's turn there. 93530 is for a right heart cath, but what I want to point out here is that this is for congenital cardiac anomalies. What does the word congenital means? It means that you're born with it. So you're only going to use codes 93530 to 533 for a congenital problem. And I would highlight that word congenital in every single one of those codes. For all other conditions, which honestly, most of them are going to be the other conditions, they would be more commonly used. Then you're going to use the other codes, 93451 to 93453. So what is considered, because you need to know what is considered congenital versus not congenital. So what's considered not congenital are what we're looking at here on this slide. Anomalous coronary arteries, patent foramen ovale, mitral valve prolapse, and our bicuspid aortic valve. So again, cardiac cath coding has gotten a lot easier because only one code is now needed for most cardiac cath procedures, including most injections, the imaging, the interpretation, the contrast, and the closure. I will tell you the most common heart catheterization is a left heart catheterization. So I would definitely put that down in your around these codes in your book. So if you were doing a certification exam, the most common one is a left heart catheterization. The next most common one would be what we call a left and right. Right heart catheterizations are done more to look at the valves. So if somebody is having a valvular issue, they would probably have a left and a right. Okay, so now let's talk about what is separately reportable, because we just said that most of them are going to be under one code. What's separately reportable are codes 93566 to 93568. So again, I would go to those exact codes, in our book and read what does it say for 93566. But more importantly, look at the plus sign before 93566. The plus sign means it's an add-on code. What does that mean? It means that it cannot stand alone by itself. It has to be attached to another code. Okay, our second point here, coronary angiography, bypass angiography, and left heart injection procedures for only our congenital hearts. Our codes are 93563 to 93565, and our pharmacologic agent administration and exercise 93463 to 464. Then we're getting into our end-stage renal disease codes. Remember I said that we do our dialysis. And most dialysis, if you know anybody on dialysis, they really are performed in an outpatient setting. The codes are age-specific. They're also based on the number of face-to-face visits. There's specific codes that we use if it's less than 1 month. And there's also codes that we use if it's reported once per month. So those are the different distinctions that will help you determine what code you're going to choose. Cardiovascular device monitoring, we're talking about our pacemakers. Pacemakers are really pretty easy and straightforward. It's based on the number of leads and the numbers of chambers. The most common pacemaker insertion is called a dual chamber pacemaker. Remember, we have 4 chambers of the heart. We have our atrium on the top and our ventricles on the bottom. How do I remember that personally? Because A is before V in the alphabet, so A's on top. And that's how I teach a lot of my medical terminology to students, is via that route, so that you can, try to make sense of it, because there's just so much to know and memorize. Next, we have our hydration, therapeutic, prophylactic, diagnostic injections, and we have our chemotherapy codes. When you're reviewing your documentation, you want to focus on the 3 things on the slide. Is it hydration versus therapeutic, prophylactic, and diagnostic? What is the actual technique? How are they administering this medicine? Is it through a push? Is it infusion? Or is it an injection? And the last thing is the time, how much time, and is it the initial first time or is it a subsequent time? For chemotherapy, most coding assignments require documentation of how is it being given, meaning subcutaneous, intramuscular, the technique, whether it's a push versus infusion, and our length of time. Active wound management. If you know what a pressure ulcer is, it's also known as a bed sore or a pressure ulcer, bed sore. They are all synonymous for people that have wounds that sometimes need to be surgically debrided, meaning that they need to be surgically cleaned out, and a lot of times patients have to go under anesthesia for that, because it goes down so deep that the only way that it really can be cleaned out is under general anesthesia. And you'll see patients that have pressure ulcers, or decubitus ulcer is the word, another word. All of these words mean the same thing: bed sores, pressure ulcers, decubitus ulcers. The type of patient that you would see with that typically would be somebody who maybe is bedridden. And that's why they have to move that patient around a lot, change their position so that they don't acquire a bed sore. And this concludes the lecture on the PowerPoint for this chapter. Thank you.